Hi, I have Sheila Hamilton on the line here.
Hello, how are you?
I'm great. Thank you so much for joining.
I'm so
Um,
happy to be here.
so I'm going to tell everybody that Sheila, of course, I'm sure everybody knows who Sheila is, but I'll let her introduce herself. But she has a background in reporting, and then she transitioned into mental health. And so today we're going to do a little bit of something different with PR talk, where instead of getting into the mechanics of pitching, we're going to be talking a little bit about mental health instead. And PR people are a little quirky, so I think that we could all use this mental health kind of time out from our pitching and to take care of ourselves, and then also a little bit of knowledge on how we can also incorporate mental health into our workplaces as well.
Yeah, sure. I want to hear more about the quirkiness for sure.
Okay. It'll be
um,
interesting.
so I'll just give you a little bit of background about my background in media. I started actually as an executive producer for the public broadcasting station in Utah, and I just loved marrying words and stories. I worked on several documentary crews and worked in marketing and promotions, and I realized I was getting a degree at the University of Utah at the time in business. And I was like, I don't want to be in business. So I rushed through a communications um, background as well. So I graduated with a double major and got a job at the ABC affiliate the day that I graduated, which was amazing to start at a mid-sized market, as just such a young person. And I immediately loved investigative reporting. I like starting things from conception to birth. I love big projects, deep projects, really going really granular on topics. And I just absolutely loved being the person who asked the hardest questions in the room. And so investigative reporting in the 90s, as you probably know, Amy, kind of went away, you know? It
Hmm.
oddly, there was this strange way that budgets just didn't allow for it. There was a much bigger emphasis on car crash and drug use and television reporting kind of moved away from me because I liked this very gritty, really problem-solving type of reporting. And so I went into radio and found that it was just like the most fun, the most incredible form of media because it's all about being spontaneous and being hardworking and being humorous. And I loved it. And I kind of thought, oh, I should have been in radio all along. And it was at this time that I was married to a man who was really popular and very successful builder designer. And we met and fell in love and had my daughter. And I was 10 years into that marriage thinking I had the best life possible when he really started acting erratically and he wasn't sleeping. He'd taken on a lot of commercial jobs and was really kind of over his skis in terms of budgeting and keeping things on track. And I just noticed his behavior. He became very impulsive and angry. And I started getting very concerned about him. And so I suggested to him that maybe he should get some mental health help. And he, of course, was defensive and telling me it was my problem. And he finally asked a doctor friend for help. And the doctor friend gave him, without even a background on his psychological well-being, gave him antidepressants. And
Hmm.
those antidepressants pushed him over into this maddening state of akathisia. I mean, he didn't sleep for another 18 days. He lost almost 20 pounds in a month. He would alternate between hysterical crying and laughing. It was really watching someone come undone. And he finally went into psychiatric care after he'd attempted suicide. And it was there that I saw really the failings of the mental health system, where nurses worked behind bulletproof glass. And he was a brilliant guy who read 3 books a week, and they wouldn't let him have books or a window, or he wasn't allowed to go on walks. He loved nature and skiing and mushroom hunting. And he just lost all hope. And the day after he got out, he died by suicide.
I'm so sorry.
And I think, yeah, thank you. I think he really lost any kind of vision of himself as a person who could begin to function again. And so I really shifted my career at that point. I became deeply interested in um, the crisis that is mental illness across America, how poorly people who suffer from mental illness are treated, how discriminated they are. I ended up writing this book really almost as a way to understand what I'd been through.
Here, I just have to show.
Yeah,
Oh,
thank
well,
you.
keep
It
talking
went
because, of
away.
course,
Yeah.
I read the book on my iPad, and it's a fabulous book, guys. I feel like, Sheila, like I know you. I mean,
Oh,
it's so
thank
odd.
you.
So that's good writing because I feel like I was there. I can envision the moments of time that you're talking about as an
Yeah.
active reader, and so I really appreciated it. Oh, here we go. All the things we never knew. You wrote that book, which was
Yeah.
great, and then that launched you into a different kind of work, I think is.
Yeah, it did. Yeah, because it was the first time that a lot of people in the mental health world had the perspective of a suicide loss survivor speaking so openly, and also combining it with the research that I did over the course of almost 10 years, to show what the mental health system in America was lacking for most people. So it's a combination of a narrative, a memoir, and also just hard reporting on what the system actually looks like and where we're really failing people.
And
And
I loved
after
it.
that,
I love the format.
thank you. I became a public speaker on issues of mental health and a real serious advocate. And that's when I decided to start my podcast also, just to
Hmm.
help people learn psychological tools for well-being.
And what's your podcast called?
It's called Beyond Well with Sheila Hamilton.
Okay. So you have your podcast, and then do you also have another company that goes in and helps organizations with mental health with their employees?
I do. Beyond Well Solutions is intended for employers who are looking for a mental health platform to help their employee base understand mental health issues. What my hope is to catch people upstream of crisis, to give them the information that they need before they have to seek counseling, before they have to go into therapy, before they're so stressed out that they're calling in sick to work. I really believe that if people were armed with this information the same way that we armed them with health information about how to keep your blood sugar under control and how to exercise well, I think that we could prevent so many crises from happening. You know, it's a multi-billion-dollar problem right now in the United States. $32 billion annually lost to people with mental illness that either are showing up at work and really not doing well, or who are not going to work at all because they're so sick.
Hmm. So are you finding that you're busier now, or have things slowed down because some companies might have lost some budget?
Way busier, way
Oh,
busier.
good. That's
Yeah,
great.
the data I saw this morning suggested that the crisis line call for the U.S. government is up 890%. Um, Employee assistance professionals are telling me they're getting almost double the number of crisis calls, so that people who might have suffered from anxiety prior are now really in crisis, and people who consider themselves quite healthy are actually having very, very stressful and anxiety ridden nights and days when they're trying to homeschool their kids and worried about being furloughed or have been unemployed. The crisis is real right now. And so a lot of companies are looking for help.
Hmm. And when I say good that you're busy, I just mean that it's good that the companies are noticing this and using your services, not that everybody is stressed out and
Yeah,
not
yeah,
happy.
I totally agree with you. Yeah, and
Yeah.
you know, it's been, I think that this evolution of understanding that wellness programs really weren't giving people enough psychological tools for well-being, and they kind of need to beef them up, was coming anyway, and then COVID hit, and so
Hmm.
it's just really exploded.
So then what tips would you have? So it's kind of like we have two audience, you have two audiences per se, or maybe our audiences might not match up in a way. So your audience is the corporate level, the company, and my
Hmm.
audience might actually be more of the workers. I'm not quite sure. It's not that we've
Mm,
delved into it, but the PR workers, a lot of them
yeah,
have bosses, unless they're self-employed, which a lot of us are, and we're moving
yeah,
that way. So we're our own boss, which is tricky. So that's maybe a
yeah.
secondary or a third audience. But what would your tips be for getting through this hard time for both audiences? Or how
Well,
can
you know,
employers help their staff?
yeah. What's really interesting to me is that the things that we do to keep ourselves healthy in our physical health, if you're a person who's quite practiced and mindful about that routine, it carries over into your mental health as well. So moving your body every day, every day. It doesn't have to be rigorous exercise, but you really should move your body every day to offload stress and anxiety. Having someone that you trust that you can talk to every day without judgment, someone who will listen to you, who actually doesn't attempt to fix your problems or tell you what to do, but who listens objectively. Making sure that you have some sort of either a mindfulness practice, prayer practice, meditation practice, something that allows us as human beings to actually stop and observe our thought process and observe how we are dealing and coping with the outside world is super, super important. And then good nutrition, really hugely important. I just went through a study that showed that people in Toronto who were in a double-blind study, people who just put in a multivitamin and a B vitamin during crisis reported 75% improvement over a control group, simply because they were watching their diets, really paying attention, and then getting the multivitamin that they needed for the nervous system to be able to cope. And then I think lastly, sleep. It's just anyone who doesn't sleep knows how crazy it can make you.
Yes.
And sleep hygiene is so underestimated in this world where we're supposed to be really busy and stressed out. But I will tell you, if you're not sleeping during this time, it's likely that your performance is going to suffer. And
Yeah.
ultimately, the people around you suffer. And so sleep is so hugely important. And then I always believe that mental illness is a crisis of sort of body, mind, and spirit, and that if you do have something you truly believe in, if you do have something you're completely passionate about, if you have a group of people who you hold up and communicate with on the regular, you have to make sure right now that you're making those connections and that you're feeling the kind of camaraderie that really binds us as human beings.
Oh, good. So, what the quirkiness about PR I can tell you what that is, and then that can possibly get into more, tips or what we should do. So PR people, in the end of the day, we're service oriented. So we are service
Yeah.
providers. So what we are trying to
Hmm.
do is be everything for everybody. And so this is
Yeah.
where our our boundaries kind of we don't keep our boundaries intact, and actually you might even call this codependency. I I
Mm.
don't know. I don't have a well, I do have a psych degree, but I don't have practice in psychology. But
Right.
so there's that, and I know for me, when I was working in fear, in the end of March, early April, very fear motivated, thinking that I was
Mm.
going to lose all my clients. So what happened was I over delivered, which is nice,
Mm.
that's great for clients, but for me, I hit a wall. I was
Yeah.
working like a crazy woman, like
Mm. Mm.
all 7 days a week in my bathrobe, like thinking I don't have time to do anything. And I hit a wall, and I put back in my exercise routine because that was even lacking.
Yeah.
And this exercise, I mean, originally I would go for walks every day to get vitamin D, but that's not that I need more than that. So I put back in some Zoom exercise, and that helped. And then I've just kind of taken a step back on what I'm doing. So I don't know if you have any thoughts on that for people.
Well, it's fascinating what you just described, Amy, because I've delved so deeply into the brain science. Like, what happens when we're under threat or crisis is that the fight or flight area of our brain, the amygdala, is supercharged. It's really firing. And it's telling the prefrontal cortex, which is the part that likes consistency, to know what's happening next. When are we going back to work? It loves those kind of things. The amygdala takes it over because it can't tell what's next. It doesn't know what's happening. It doesn't know where the truth lies. And so the amygdala is really firing that kind of the chemicals in your body that make you, just as you described, kind of like crazy energetic, hyper vigilant, um, very doing oriented, making sure that everyone is okay, and what's wrong with that is that unless we know that we have super stores of cortisol, which is what the brain is asking us to use when that's happening, you're going to hit a wall that's really can be very, very dangerous for your health long term. A lot of the illnesses that we think of, like chronic fatigue and whatever, those people describe what you're describing in the months prior to that. I was just hyper all the time. I was taking care of everyone. I was making sure. So we have to be really conscientious about, oh, okay, I see myself cleaning out my closets again for the 9th time. I see myself hypervigilant around contacting that particular customer. What am I doing for myself right now? And I have really taken my clients through a very regulated grounding yourself exercise where when you start to see that happen, I am not kidding you, it's really important to sit down, to ground your feet into the ground, to feel your butt in your chair, to take some huge cleansing breaths to oxygenate your brain, and then name 5 things you see in the room. My computer, that game, my dog, so that you begin to get the brain back online. It's really important to go through these daily, if not as often as you can, mindfulness tips so that you're not carried away in that constant kind of doing, exhausting circle that really does land a lot of people in psychiatric wards. It is
Okay.
one of the reasons
That's
why.
good. Well,
Yeah.
yeah, I was like, oh, I should have talked to you earlier. And I do have to say,
That's hilarious.
and it's better now, but I do have to say though, it does sound good from a client or a boss perspective, like go, 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 work, work, work. But what I realized, I might have been putting out more, but what I was putting out, we can't use either.
Oh
See,
dear.
so because we have to be, we can use some of it, but
Yeah.
we can't, in PR, we have to be strategic and we have to think
Yeah.
about how we do things. And so it's not like, well, so less is more in PR. So we can't,
Mm.
does that, so anyway, that's
Yeah,
just
of
another.
course.
And then the other thing about PR people is, as I mentioned, service oriented. A little bit of that also comes into the gender of PR people, and a lot of PR people happen to be women. There's stats on that. And so women being service oriented is one thing. But another thing that I've found is a lot of younger women have imposter syndrome. And
Hmm.
so I think, and when we're coming up in our careers, we're always, again, it's fear based. We're always trying to prove ourselves. And so this probably goes hand in hand with the boundaries possibly too, but just that imposter syndrome and the fear. And that I think during this time, COVID-19, you think, oh, I've got to work, 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 and prove myself because I'm working from home. So
Right.
nobody knows what I'm doing. I don't know if you have any thoughts on
That's
that.
such a good point. I do. I was just on a huge webinar with 200 women from all over the world, and I was so struck that it didn't matter what race you were, what economic status you were, what gender you were. Every woman on that call was saying that they felt somewhat like a failure during this time because if they're home and the kids are home, they're failing at making sure the kids are doing online learning. If they're working too much like you, they're worried they're putting out too much content and not enough good content. If they are unemployed, they're deathly worried about paying their rent and worried the government isn't actually going to show up with the money they've promised. If they're like the concerns were so uniform that honestly, by the end of the call, I think everyone felt a little better to know that everyone's struggling.
Mm-hmm.
There's nobody that I've talked to who's like, yeah, I'm just killing it. This is the most amazing time for me. This is like awesome.
Yeah.
I'd be so worried about a person actually if they said that. Because I do think that if you have any degree of empathy or compassion for other people's plight, you can't help but feel anxiety ridden about what's happening across the world. And that permeates women's lives and it permeates how we do our business. That empathy factor and that willingness to be vulnerable really does seep in to how we're doing. So it makes sense to me that women are feeling this way right now.
And we're not alone, so
Right.
that does
Yeah.
help. Um, and then the last point about PR people, it has to do with news consumption,
Yeah.
and then there's news consumption because we do need to watch the news, or pay attention to it to do our jobs well. But then there's also the point that sometimes we're tying into COVID-19 if we have a
Mm,
product that actually could help COVID-19.
of
And
course.
I just have to say, for all the PR people listening, I don't think we should be tying into COVID-19. Like, we're not
Yeah.
doing that, okay?
Yeah.
Because that's kind of stormy and not effective. People can see through that. But I'll just say, one of my friends in PR, she actually turned down a client that was doing antibody testing for COVID-19 because of her mental health boundaries, because
Oh,
she knows she's a big news consumer. It really affects her. Everything's affecting her. She went to the grocery store and came home and cried because she thought, well, I can afford these groceries, but other people can't. So she's very sensitive. So she knows that about herself, and she turned down the client.
mm,
So now, me, on the other hand, I have a client that it's a software that can help with this. And I do the opposite. I'm like, yeah, I'll take it. And I'm working, like, I carry the burden too much. I think,
mm.
oh, this could help the world. I should get all this that I can. And it's like, it's out of our, what's hard about PR is that it's out of our control,
Mm.
like the coverage that we get.
Yeah, I think honestly, if there's any time we should be disciplined around a brief appetite for consuming the news, it's now. I really do. I think, for myself, I allow myself 10 minutes in the morning. I go to 3 different sites, so I sort of get somewhere in the middle because somehow this has become politicized. Um, I really read deeply in the evening newspaper accounts. I'm not listening to radio. I'm not listening to TV. I listen to a lot of podcasts that go deeper on topics, but I'm avoiding that talking head, sensationalized, everything spiraling out of control narrative, because I actually believe that there's an enormous opportunity here for us to really grow from this, to reimagine our businesses and to reimagine the workforce in a way that's more equitable, and to actually have an eye toward the environment and what we are capable of doing, of improving the environment. So you're not going to hear that on the evening news. And I really believe that you have to be disciplined about seeking out those people who are thinking beyond the crisis to what's next, because none of us are any good to one another if we stay trapped in this fear cycle. We have got to move to the next problem solving cycle. And the only way you do that is by limiting the amount of exposure to the other stuff.
Yeah, it's crucial.
Yeah.
So, any thoughts on how PR people can, what should PR people do right now in terms of?
I really love that question because I'm the same way as you. I find, companies that are trying to meld their messaging about tires in with, caring about COVID-19 to be jarring. And I think that there's a much kind of broader perspective that companies could take, which is to really take care of community and their employees right now, to shift their mindset away from building their brand to the outside world. How do I help my customers and my employee base? It feels super important to me to have, if you can volunteer, if you can give, if there is the capability of your company to do something that helps in this battle, this fight, um, especially for healthcare workers, you must engage. You must. Do you need to advertise it? No. Do you need to tell anyone about it? No. It's bound to get out anyway. Let the word of mouth, the real communication that is positive that we've been talking about, carry itself out there. And I think companies that do that are going to just lead the way in terms of our recovery out of this.
Okay, well, great, thank you. Are there any last minute things that I didn't ask you that I should have, that you want to?
No, I definitely can't wait to return the favor and have you on my podcast, though. I think that'll be a wonderful, wonderful conversation.
Yeah, definitely. Well, and then last business keeping items, where can people get your book and where can they learn more about your company and your
It's
podcast?
It's called All the Things We Never Knew, and it's available everywhere books are sold, although you can't go in bookstores now. And of Amazon, every online bookseller has it as well. And then my website for the public facing podcast, which is kind of longer storytelling, is at Beyond Well with Sheila Hamilton. And our solution for employers who are interested in having something that their employees can go to learn more about taking care of their own mental health is at beyondwellsolutions.com.
Okay, great. Well, thank you. I really
It
appreciate
was
it.
such a pleasure to spend time with you. Thank you again.